Welcome everybody to this morning's webinar on consumer engagement in safety and quality. It's fantastic to see so many of you who have logged in and registered, and there's been a great amount of interest for this webinar today. We have a variety of people online: directors of clinical governance, consumer advisors, committee chairs, people responsible for patient feedback, patient safety managers, clinicians, and many more. I'd like to just start with a little bit of housekeeping. My name is Dr. Karen Luxford. I'm Director of Patient-Based Care here at the Clinical Excellence Commission. And it's important for those of you who have logged in, if you have cameras on your computers, to make sure that you've turned those cameras off. Otherwise, all others can see you. It's also important to note that we have a chat facility. So if you're wanting to submit questions to the presenter, please do that via chat mode, and we will aim to get to those at the end of the webinar. Also, please note that the teleconference link information that was sent in to you via the emails to those who registered is the correct information, not the information in the pop-up screen on the webinar. So we've resent that, and a number of you have already taken note of that. So please use the original instructions. I'd like now to introduce this webinar. This is part of a series of joint webinars between the International Society for Quality in Healthcare and the Clinical Excellence Commission. The International Society for Quality in Healthcare is an organisation that has members from around the world. It is focused on the key issues in safety and quality, and we've been working together collaboratively on a series of regional initiatives, including these webinars. It's also important to note that a fellowship program is available to allow you to really hone your skills and knowledge in the area of safety and quality, and we would recommend that program to you. The Clinical Excellence Commission here in New South Wales, Australia, has been involved in safety and quality for 10 years now, and we work across a range of different areas to promote the safety and quality of care that patients receive. And part of the work that we do very much focuses on how we engage patients and families and carers in that drive to improve safety and quality. It's on that note that I'm very pleased this morning to welcome our presenter, Stephanie Newell, who is also the chair of the Clinical Excellence Commission's Partnering with Patients Advisory Committee, and has a number of roles both nationally within Australia and also with the World Health Organization internationally. Stephanie is a champion for patient safety, and she's going to be talking to us today about consumer engagement in safety and quality. Over to you, Stephanie.
Thank you, Karen, and good morning, everybody. Thank you so much for joining us today. It's wonderful to see so many people online for the webinar. And I'd also like to take this opportunity to acknowledge the Clinical Excellence Commission's consumer advisors that are online as well. So welcome to you. Today's webinar, we're going to focus on consumer engagement and really about involvement of consumers as partners. Within healthcare generally, there are levels of engagement for patient-focused care, and they range from the individual service levels, organisation levels, and the regulatory level. So just to orient everyone for this morning's webinar, we're going to be focusing on those service and organisational levels in particular, with some of the regulatory levels. The individual level really focuses around individuals' engagement in their own care. So we won't be looking at that in particular today. It's the other levels that we'll be focusing on. So we're talking about consumers being involved as partners within the systems of healthcare organisations. So your health services, your hospital, within the systems, within the governance structure. It's interesting to note that patient engagement is something that is really seems to be coming to the fore in the last few years. But we know for many years it's certainly been a focus, particularly in areas like mental health. And many countries have had engagements with patients enshrined in professional standards for a long time. And some of those mechanisms have also been documents like Patient Charter of Rights or Bill of Rights. So the benefits to consumer engagement within healthcare and having consumers inform the healthcare system, the health structure, the healthcare organisation, the health service, in those governance and systems levels, can range from higher quality care for patients as outcomes, because those eventual services are informed and directed by consumers themselves who are within the system at different levels, working within committees, in an advisory capacity, or within policy and procedure development. Services can therefore be cost effective. Because of this, there's reduced waste in services being formed and shaped inappropriately. One example of this might be, and many of you I'm sure have experienced this, where a simple matter of car parking and access to a health service can lead to missed appointments and therefore missed treatment for patients. And so that increases the cost of healthcare by people not being able to access their care, their appointments, or something as simple as not being able to find a car park to do so. Other benefits certainly are improved health outcomes for people, because the services are informed by people that use the service. They have the experience of understanding what that's like to use the service, or also to inform what patients actually need and want and what their preferences might be. So therefore a greater experience of care and of using the service in general is something that people who use the service do experience. So it's that patient-focused approach, ensuring that people's needs and preferences are met. Other benefits to consumer engagement at the service level, which is often underestimated, is that it's a vehicle for staff insight. By working together as partners on projects, initiatives, on policy formation, on committee decision making, staff get to build a relationship with health consumers. And so there becomes a partnership formation So there's understanding, and certainly positive relations are built because there's a common goal and an endpoint. Different perspectives might inform that endpoint, but certainly those relationships are formed, and this can only enhance the end goal of patient-focused care. And as a result, this can lead to greater job satisfaction for staff as well, because they see the benefits and the outcomes for the patients. The patient's experiences are improved, and so it can be a win-win situation. So this next slide I've actually oriented it to fall in alignment with the National Land Safety and Quality in Healthcare Standards 2.2, which is around safety and quality and ensuring that consumers are involved in the safety and quality of the organisation. And to provide some examples in these areas of service planning, decision making and quality improvement. Within the service planning and strategic and operational, I'm going to talk shortly about the REACH program that the Clinical Excellence Commission initiated. So I will move to that after this slide and talk to that in more detail. Under service planning, an example that I can provide about something that strategically was discussed at policy level with consumers and staff around an organisation's emergency department and the presentations of patients to the emergency department. It's common that emergency departments experience overloading, and as one organisation I'm aware of, and I was actually involved in this example, that the organisation asked the consumers on its advisory committee what they might do to assist in reducing presentations to the emergency department. So consumers provided feedback, and it was decided that consumers would attend the emergency department and conduct a survey of patients within the emergency department. And so people on this advisory committee, consumers, were oriented to the survey, and they went into the emergency department and conducted the surveys and the interviews with selected patients within the department. And the outcome of this survey, which went over a number of weeks, was quite interesting because from an organisational level, the assumption was made that people were presenting to the emergency department for unwarranted reasons. But what the survey actually indicated was that people were coming to the emergency department for correct reasons, because they actually had no other mechanism to enter the system, and that they had actually personally triaged the reasons why they should present to the emergency department in the first place on their own initiative. So it was interesting, the findings of that survey, to find that those patients, those people who were presenting, actually did need to be there, and it wasn't just purely because people saw that that's where you go. But they actually undertook decision-making processes about that that's the place that they needed to go to in difference from their general practitioner or other health service. So that certainly provided some really interesting findings, and as a result of that, there were policies and procedures put in place around further discussion with patients when they presented to the organisation, to the hospital, and also some other support in place for people when they did present as an outcome of the discussions with those patients. So getting back to the service planning and strategic and operational levels, another example is complaints as well within the organisation. Consumers can be involved in the complaints review. One hospital in Australia I know of has its advisory committee review complaints on a regular basis, and the complaints are de-identified. The consumers on this group look at the response provided by the organisation and adds any comments to the response, recommends any different responses be made or additional responses, and any follow-up that they deem that consumers would actually and should actually receive. Some of the focus and initiatives that are occurring throughout Australia. One organisation ensures that every month, every quarter, they are provided with the meal of the day that the patients within the service are receiving, so that they can actually have a real experience of what that meal is like for the patients within the service on that particular day. So not only is this a way of reviewing the service's facilities around food and nutrition, it's also a hands-on opportunity for those consumers to discuss with the health staff within the organisation around the food and food issues as well. So it's a very good way and a very real way, a real-time way of ensuring that occurs. Other quality improvement activities, examples, are consumers being active within the organisation and conducting hand hygiene audits where they have a role within the ward or other areas within the organisation where they can observe and monitor the activities relevant to hand hygiene of the health staff, and they have the opportunity to record that and take that back for further discussion within their own group and within the organisation at a policy level. Just flipping back now, as I said, to talk a bit more in detail about the REACH program here at the Clinical Excellence Commission and within predominantly New South Wales within Australia, involving consumers in safety at the sharp end. You can see that the acronym there for REACH is Recognise, Engage, Act, Call and Help is on its way. So the development of the REACH initiative certainly came through the involvement of the consumer advisors at the Clinical Excellence Commission right from the start, and you can see a picture there of the previous chair of the Partnering with Patients Advisory Committee, Alicia Wood, who came up with the REACH acronym. From there, consumers on safety and quality working groups at the hospital level assisted with the local plans for delivery, and that occurred in places like Orange and a number of other places throughout the state. Within the care delivery, patients were empowered and their families to make the care safer at the bedside, and this was done by using the REACH steps so that patients and their families were advised and oriented that they could, if they recognised that something was not right, if they were really worried, if they had a concern, that they could act on those concerns, that they could engage with the treating team, the nurse or the doctor, and let them know about that concern. And that if they were still worried about that concern, they could ask someone in the treating team for a clinical review. So that's the action part of REACH. And that they would be assured that this review would happen within 30 minutes of their request. Then if they were still worried or concerned, that the patient or family member could call an emergency response on the ward by phone or on their own mobile, and that would go directly to the senior nurse manager. After hours, it would go to the after hours nurse manager, and help would be on its way. So that initiative has been involved in an evaluation. Patients and families have provided their formal feedback about the experience after they've initiated a REACH call. And you can see Christine there, the photo on the lower left. And Christine made the first REACH call in New South Wales for her mother because of the concern for her care. So we can see that having consumers engaged and involved and participating throughout that whole process, and we have that total feedback loop, we can ensure that our initiatives, our services, and the care that people experience is continually being monitored, is continually being improved, and the benefits that that can bring because of that. I'm going to move on now to talk a bit more about how we can assist people who wish to come into our organisation at a systems level as consumers, whether that be on advisory boards, advisory committees, working groups, and projects and initiatives. And certainly one of the ways which we can assist people to fulfill their role is to provide education and training, and certainly have orientation to their role. And when we're talking about safety and quality, to provide some understanding of what safety and quality is and what that encompasses for people. And so the previous slide showed that one of our training days here at the Clinical Excellence Commission for the consumer advisors around safety and quality had a particular focus on safety and quality and what that means within healthcare. This is certainly also a requirement under the National Safety and Quality Healthcare Standards as well. The that consumers are supported in their role and that training and orientation is key to this. Many organisations arrange ongoing training for their consumers within the organisation that aligns with the training that the staff also receive, so that there is a general understanding of what actually goes on in this organisation and that we have an understanding across staff and consumers about different issues such as hand hygiene or other safety and quality areas. The consumer advisors here at the Clinical Excellence Commission have been established since 2010, and they act as a Citizens Engagement Advisory Council as well. Many of those of the consumers here undertake both roles, and they're integrated into the programs and projects of the Clinical Excellence Commission. And they also share their personal stories of care and their experience of care with healthcare staff and of their services. One of the things that is really key to ensuring, and what the Clinical Excellence Commission have done here, to ensuring people are trained and educated for their role as well, is also matching people with the activity to gain an insight into what those consumers' interests are and what they wish to contribute to as well. We know that many consumers, or all consumers, have had a life outside healthcare, that they are very experienced and in other fields outside healthcare, and that they are very experienced from their own personal journey within healthcare as well. So we have an opportunity to utilise those skills and build upon those skills to enhance our programs and projects and the way we develop our policies throughout healthcare accordingly. Local engagement is a word that I've just concocted just to really illustrate that we can look and link people on a wider scope, and the example there I'm using is the Patients for Patient Safety program of the World Health Organization, of which I'm a member of. And there are certainly emerging, because of the internet capabilities these days, the opportunities for people to link up from remote sites to actually provide input and their experience and insights into policy planning and service delivery remotely. As a group, they can discuss on a wider scope and take those discussions and key learnings back and be utilised at the local level. So, for instance, to illustrate, the Patients for Patient Safety program has members stretching across the world, and we link up via a virtual community. We are involved in some of the WHO, the World Health Organization's patient safety initiatives throughout the world, but we also share experiences and opportunities that we have at the local level. And so by those discussions, by learning from one another, we then can take that back to our local level, to our local health service, to our state, and work on those issues and know that there are others throughout the world working on this very issue, experiencing similar problems, but sharing the solutions. And so there's a real capacity building opportunity. We've seen this occurring in Australia as well, where a number of health services and health organisations are linking up their consumers and their community also via virtual means. They're able to cast a wider net and to involve people from diverse populations and access them in ways not able to previously. So this certainly creates a much more universal scope for people to be involved. And acknowledging that not everyone has internet access, but it commences a dialogue on how to enable those people who have access to information electronically, how they can provide solutions to access those communities and people who may not have that ability or have that facility available. So please keep that in mind when you're thinking about your engagement with consumers within your service or organisation. And just to finish up, the last couple of slides show us how within safety and quality we can certainly provide information to the community and individuals about the organisation's safety and quality performance. And this is the real-time information that's available on the Clinical Excellence Commission's website for the community and consumers. And you can see there's information on hand hygiene, handover, medication safety, and falls. Now this resource has been developed with the input of consumers at different steps of the process of the resources development. And when consumers were consulted around the content of the resource, the things that they identified that were important for this type of resource, a community-focusing resource, was that they wanted to know what was happening, why it was important, how it was important, and what they should do about it. So you can see that's the way the resource has been structured. So it informs people about the topic or the issue, why that's important, what the organisation, and in this case the Clinical Excellence Commission, is doing about it, and how they, as individuals and community members, can actually assist as well. So what does it mean for them? And this resource is being used by many services and organisations as a template for their own service information to provide to their local communities. So I'd encourage you to have a look at that and utilise that as you see relevant for your organisation. And know that it has been developed in conjunction with consumers. So it has the consumer-friendly and user-friendly approach in the development. So that's the end of my presentation, and we have some time now for some questions. So if you'd like to use the chat box to send me your questions, and we have about a few minutes to answer some questions. I have a couple already, which I'll start on as you think about your questions. So the first question is there a right time to engage with former patients if they experience harm. I think there's certainly a right time, and the only person that can really gauge what that right time is the person themselves. I don't have a lot of background about this, but one of the ways I know that health services are utilising to do this is through their complaints mechanism. So they're reviewing complaints of people who have advised the service of an issue and an unsatisfactory care or experience. Because we know that people provide solutions within those complaints. The way to approach people who have experienced harm may be through a complaint mechanism, or it could be through an open disclosure process. So it's about approaching them or being in discussion with them and making a sensitive approach to ask whether they wish to engage with the service to assist in its future development of solutions, whether that be around particular areas of safety and quality, such as hand hygiene, or falls, or patient safety itself. I hope that answers your question. So we have one more question, which we, because of time, will make our final question. And the question is, if you have a committee focusing on accreditation and Standard 2, should you include consumer input? Without a doubt, yes, is my answer to this. Most certainly, because consumers can provide a more contextual information to that standard and to the accreditation. They can certainly provide their experience and certainly their understanding of what a solution might be to ensure that is addressed, whether that's an element of Standard 2, whether it's an element of accreditation. And so their involvement should be throughout each stage of that committee's work, no matter what its focus. So definitely having consumers involved is key to that. So I'd like to thank you all again for participating in today's webinar. And I will say goodbye now and wish you all well. Thank you, everyone.
Thank you very much, Stephanie and Yul, for today's webinar. I'm hoping you enjoyed that information and that it was useful to you in your own work environments. I think Stephanie's key message is there are a range of ways that you can engage with consumers in safety and quality. In some cases it may be on committees, in other ways it might be on evaluation, it could be on strategic planning. There's really a variety of ways of going about this. Just in answer to one further question that I've seen just pop up, what is the C in the acronym REACH? It stands for CALL, as in Call the Rapid Response Team, which is what we're empowering patients and families to do. So in signing off, I wanted to let you also know that our next joint webinar with ISQA will be on the 15th of May at 8:30 in the morning Eastern Standard Time. It is with Professor Sir Bruce Keogh, who is